Avinash, you can start, bro.
Grace, you are on live.
Yeah. Good evening, all. I'm Grace Angel from Mara Medical College and Research Institute and a member of the Mental Health Subcommittee, IMA-MSN TNSP. I consider it a privilege to moderate today's session on behalf of the Indian Medical Association, Medical Students Network, Tamil Nadu State Branch. On behalf of IMA-MSN and Junior Doctors Network, TNSP 2026 to 2027, I extend a heartfelt welcome to our respected state leaders, distinguished speaker, and all participants who have joined us for this intellectually enriching session. At the outset, I would like to express our deep gratitude to the visionary leadership of IMA TNSP for their continued mentorship and encouragement. Dr. B. Sridhar Sir, State President, Dr. P. Sengatuvan Sir, past State President, Dr. A.K. Ravikumar Sir, President-elect 2026, Dr. N.R. Tyagarajan Sir, President-elect 2027, Dr. M. Thiravyam Mohan Sir, State General Secretary, Dr. D. Solomon Jaya Sir, State Finance Secretary. I also extend my sincere regards to our state leadership team, Dr. R. Annamalai Sir, Chairman, IMA-MSN TNSP, Dr. S. Jamunarani Ma'am, Co-Convener, Chairman, IMA-MSN TNSP, Dr. V.S. Hariharan Sir, Chairman, IMA-JDN TNSP, Dr. Kannan Rajendran Sir, Convener, IMA-MSN Subcommittee. My appreciation to the state team whose dedication continues to drive impactful academic initiatives. Arunagiri Sir, Convener, IMA-MSN TNSP, Ajay Karthik Sir, General Secretary, IMA-MSN TNSP, Bala Hariharan Sir, Co-Convener, IMA-MSN TNSP, Hariram Sir, Co-Convener, IMA-MSN TNSP. Vaccines have transformed the landscape of modern medicine, preventing millions of deaths and altering the course of infections, diseases globally. However, the challenge we face today is no longer just scientific, it is deeply human. Vaccine hesitancy is shaped not merely by lack of information, but by trust deficits, cultural narratives, emotional perceptions, and the influence of rapidly evolving digital ecosystems. In an era where misinformation can travel faster than evidence, the role of a doctor extends beyond prescribing. It requires listening, engaging, and communicating with clarity and empathy. Today's session invites us to reflect on key dimensions like the ethical accountability in addressing patient concerns, communication strategies that foster trust rather than resistance, the impact of cultural and societal context on decision making, and much more. Understanding these aspects equips us not just as clinicians, but as advocates of public confidence in healthcare. Now, I kindly call upon Raihana Tasneem, Head of Mental Health Subcommittee, to take over.
Thank you, Grace. Good evening, everyone. Myself, Raihana Tasneem, a final year MBBS student from Chengalpet Medical College, a proud student of Sarath Balaji Sir. Now, it's an immense pleasure to introduce the speaker for today's session. It is a matter of great privilege to introduce our esteemed speaker for today, Dr.
Sarath Balaji Sir, Associate Professor, Department of Pediatrics, Chengalpet Medical College. Sir is a distinguished pediatrician and pediatric pulmonologist with extensive clinical expertise, particularly in respiratory medicine and immunological disorders. With over 5,000 bronchoscopic procedures, his clinical experience is both vast and impactful. He has been recognized with several prestigious awards, including IAP Active Pediatrician Award 2019, Tamil Nadu State Academic Excellence Award 2025, JV Gold Medal during MD Pediatrics. Beyond clinical work, Sir has contributed significantly to academics through publications, teaching, and leadership roles in pediatric programs at both state and national levels. His insights into immunization and public health challenges make him an exceptionally well-suited to guide us through today's session. We are pleased to have you with us, sir. With that, it's my honor to invite Dr. Sarath Balaji, sir, to deliver his session on vaccine hesitancy in the modern era. Thank you, sir. We look forward to your valuable insights. We welcome you, sir.
Good evening, friends. Am I audible and visible?
Sir, you're audible, sir, but your video alone is not visible, sir.
Not visible. One second. One second. One second. Am I
Yes, sir, you're visible, sir.
visible? So am I audible now?
Yes, sir. Yes, sir.
Okay, let me try to start my screen. One second. Okay, can you see my slides?
We can see, sir.
You can see my slides now?
Yes, sir.
Yes, sir.
Okay, shall we proceed?
Yes, sir. We can start, sir.
Okay, thanks for the nice introduction. First of all, it is very, very happy to see these young guns are taking so much of responsibilities nowadays. I could see future leaders in each and every one of you. And really, after coming to Chennai, this is after having spent for about more than a decade, 16 years of my experience at Institute of Child Health. Unfortunately, since it was a specialty department, I did not have any enough opportunity to meet undergraduates. Only after coming to Chengalpattu Medical College as an assistant associate professor, really I am gifted enough in this path to look, to see, to get inspired from all of you, particularly the way you commit to the academy as well as to the patient management. Right, I'm Dr. Sharad Balaji. There was a long, detailed introduction was given by my dear friends. Today's topic, what is today's topic? Today's topic is vaccine hesitancy. Okay, why some people are hesitant of getting any vaccines? Is it okay for you? Is it audible and visible now?
Yes, sir. It's audible, sir.
Okay. So what is the purpose of this topic, vaccine hesitancy? If someone is expecting me to say all positive points with respect to vaccine, it is not so, my dear. It is not so. Vaccines do have some side effects. Can anyone tell me what are all the types of vaccines available? I would like to hear someone who can answer to my questions. We will have an healthy discussion. Can anyone tell me what are all the types of vaccines we have? What are all the types of vaccine we have? So basically, what is the role of any vaccine? If you give any vaccine, that vaccine is going to produce an immune response, antibody. Okay, so whenever that particular infection hits you, that preformed antibodies produced by the vaccine is going to protect your body against that particular infection. This is the basis for vaccine. How do they produce all those vaccines? Vaccines are basically two types of vaccines, basically, by and large. One is killed vaccine, another is live attenuated vaccine. Vaccine is nothing but an antigen, as well as it has got disease producing ability, otherwise known as pathogenicity. So each and every vaccine has got two things. One is to produce antibodies, and remember those live attenuated vaccines. Remember, they are live attenuated. What do you mean by that attenuated? Because when you give live vaccine, the vaccine contains those organisms, okay, live in that particular bottle or vaccine syringe. But they will attenuate the disease producing nature or pathogenicity of the organisms. So they will act simply as an antigen rather than producing a disease. So we have so many live vaccines indeed. Killed vaccines are absolutely safe because they are killed. You are absolutely removing the pathogenicity from the vaccine. But as far as a live vaccine is concerned, it is a potential disease producing organisms are present in the vaccine syringe. Can anyone tell me what are all the live vaccines that you know? Can anyone open your mic and tell me, unmute yourself and tell me, each and every one of you, what are all the live vaccines you have? Just mention few, one or two.
MMR, sir.
Fantastic, MMR. Then, apart from that, you have only MMR, you don't have any other vaccine? Varicella, you have, okay, very good varicella. Apart from that, MMR you told, varicella you told, very good.
OPV.
Fantastic oral polio vaccine that we give is a live vaccine. Then what is the first vaccine that you get after birth? Immediately after birth. Yes. So what are all the live vaccine we have? You have BCG, the first live vaccine any child that receives, or one is BCG vaccine, another is oral polio vaccine. Then comes your hepatitis A, your measles, mumps, rubella, varicella. These are all predominantly live vaccines. Remember, live vaccines, is it possible to give a live vaccine to a person with immunodeficiency? If you come across a case of human immunodeficiency virus, an AIDS patient, will you put any catch-up or mixed vaccine? A 12-year-old child, HIV positive AIDS patient comes to you for vaccine. He is saying that he missed so many vaccines and he wanted you to proceed for catch-up vaccine. Will you do or not? Yes, no. Say yes, no.
No.
An HIV patient comes to you. He is also having AIDS. His CD4 counts are less. Will you opt for live vaccines? Yes, no.
No.
No, because whenever you give live vaccine, that live vaccine is going to proliferate in his body, provided his immune system is not intact. If his T cells are not working, B cells are not working, your live vaccines like oral polio vaccine can produce poliomyelitis by itself. Remember, children with Bruton's A gamma globulinemia, otherwise associated with X-linked A gamma globulinemia, when given oral polio vaccine, that vaccine itself will produce polio. Point number one. Look at the child I am showing you right now. What is this, my dear? What is this? Can anyone tell me what is this? What is this? Look at the site of BCG scar. Look how far the BCG had penetrated his body and producing a large left axillary adenopathy. That adenopathy is not healing. That left axillary adenopathy is not healing. The left BCG scar is not healing. Look at the child is sick over the mother's lap. Why all these due to this live vaccine called BCG? BCG was accidentally given to a child with severe combined immunodeficiency and is manifesting as BCGosis. What do you mean by BCGosis? Your live vaccine, BCG vaccine, will produce BCG disease. It means your vaccine itself produced disseminated TB. This majority of immunodeficiency are manifesting after giving live vaccine, particularly your Bruton's A gamma globulinemia manifesting as poliomyelitis after giving oral polio vaccine. Your severe combined immunodeficiency is going to manifest itself as disseminated BCG-induced TB after giving vaccination. There are so many case reports as of now. After giving COVID vaccine, there is increased incidence of thrombosis, stroke, and myocardial infarction. It doesn't mean that I need 1 second. 1 second. Soluma. Soluma. ஆமாம்மா அதை முடிச்சிருங்கம்மா. ஆமா அது 5 daysமா, எல்சின் 7 days. வெறும் எல்சின் மட்டும் கொடுத்தாலே போதும். நான் ஒரு மீட்டிங்ல இருக்கேம்மா, ஃபோன் வைங்க. Okay, right. So what did I say? So there are so many case reports, and my children will be wondering how this man is talking all negative about vaccination. Yes, we do see all those serious side effects in our tertiary practice. Yes, we do see. Okay, but by and large, the number of cases that we see is far, far, far less compared to the cases which we will be seeing if the child is not getting any vaccination. Believe me. We didn't have any smallpox right now. Do we have any smallpox? No. Do we have any poliomyelitis case? No. Do you have so much of hepatitis? No. Japanese encephalitis, it is there, but it is reduced. Okay. Measles, we have been seeing many cases of measles in the past 3 to 4 months. Many cases of measles. Why? One particular religion is not opting for vaccine. In my clinic, as well as in Chengalpattu Medical College, as well as in some other hospitals I am visiting, majority of measles belongs to that particular religion. Yes, by giving vaccine, there are some issues, but by and large, when you don't give any vaccine in this era of overcrowding, basically in a school we used to have 30 people. Basically in a medical college we used to have 50. Right now we have 250. A school has got more than 80 to 90 kids. So what happens? Each and every infection will spread as fast as like a fire, leading to disseminated infection overall. So when vaccine is not given, the catastrophe you can't imagine. So what I would like to say, the answer is very simple. Vaccines, yes, do have certain side effects. Yes, it has. But you need to do risk-benefit ratio. The benefit ratio by giving vaccination is far ahead of the side effects that are produced by vaccines. But beware, my dear child, beware, my dear students, whenever you opt for any vaccine, kindly ask, kindly look into that vaccine, whether it is a live vaccine or killed vaccine. Killed vaccines are safe. Live vaccine cannot be given to your children with immunodeficiency, whether it is a primary immunodeficiency in severe combined immunodeficiency or secondary immunodeficiency such as HIV, a children on chemotherapy, a children who received radiotherapy, a children who had undergone stem cell transplant, a child who is on prednisolone for rheumatic fever or nephrotic syndrome. These children are said to be immunosuppressed. I repeat, beware of live vaccines in immunosuppressed children. Beware of live vaccines. Okay? But in an immunocompetent host, they are absolutely safe. Right. So now let me go to a series of case scenarios and let us presume how you are going to act in all those cases. First case, there are huge reports of autism spectrum disorder in children who received MMR vaccine. Measles, mumps, rubella vaccine. You know autism. What do you mean by autism? Vision will be normal. Hearing will be normal. But there will not be any comprehension. There will not be any eye-to-eye contact. The child will be in a different world playing playing on his own without listening to others. That is called autism. And after this ChatGPT, after this Googling, after this so many social network influencers, majority of people are really afraid. What for they afraid of? Doctor, if I have seen so many reports of, so many case reports in which a study has been published in which autism is more in children who received MMR vaccine. That particular case report has been retracted from the literature. They removed from the literature. Why is it so? Because there is no foolproof evidence to say that the MMR vaccine is predisposing to vaccine. And remember, my dear friends, do not think that whenever you see any case report or any case series, it doesn't mean that they are all true. Okay, so this particular study in which autism's association with MMR is disproved. Remember, usually mother find out this autism by about 9 months. When the child is not turning back, when calling by his name, there will not be any eye-to-eye contact. Remember, by at the same time, you will give either MMR vaccine at 9th month or another MMR vaccine at 15th month. So this is a mere correlation. I repeat, in my past 17 years of private and government practice, I have seen huge number of autism, and there are huge number of people who received MMR vaccine. But remember, the majority of autism are mainly due to nuclear family. As soon as the child is born, almost both father and mother are working. Grandma is only taking care of their children, grandchildren. And they will be tired. Once they are tired, they used to give mobile phone to the child. By about 7th month, 8th month. More the mobile, less the eye contact, less the speech. So it is due to deprivation of the tender loving care environment given by the family and attributing everything to MMR. MMR vaccine is not associated with autism. It has been disproved and there is no causal link proven in large studies. So whenever any mother comes to you, when you are sitting in a vaccination OP, when mother is asking you, shall I proceed? Do my child get autism? The answer is no. Proceed for the vaccination. That is what you need to tell. 2. Fever post-pentavalent. Remember, my dear friends, 6-month-old child, pentavalent vaccine, usually we give at 6 weeks, 10 weeks and 14 weeks. Let us presume that instead of 6 months, let us presume that 6 weeks. So the child had received vaccination and the child developed high-grade fever within 24 hours. There is no localizing sign, there is no cough, no cold, nothing. Okay? Whether this pentavalent vaccine produces fever, the answer is yes. What does pentavalent contain? Diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza. Among these 5, the one which is notorious to produce fever is whole cell pertussis vaccine. So if there is an incessant cry, if there is an high-grade fever, if there is an associated seizures, after taking 6 weeks, 10 weeks and 14 weeks vaccine, pentavalent vaccine, which contains many vaccines, but the most common culprit is the pertussis component of pentavalent vaccine. Remember, my son is right now 20 years old. When he was young at 6 weeks, 10 weeks, 14 weeks, I had given the whole cell pertussis vaccine only. He was crying for about 3 to 5 days after each and every primary series and a severe pain by about 16-month booster series. It is well established side effect of a pentavalent vaccine. But these are all not contraindication for the subsequent pentavalent vaccine. If the child develops encephalopathy, altered sensorium within 7 days of receiving DPT vaccine, then it is a contraindication. Whatever I told, high-grade fever, febrile seizures, child suddenly become hypotensive, incessant cry lasting for more than 2 to 3 days, all are well-established side effect of pentavalent vaccine. If the mother is asking you, doctor, will my child develop these side effects after giving pentavalent vaccine? The answer is yes. But is it curable? Yes. What you need is a simple dose of paracetamol for about 2 to 3 days. But in majority of the private setup, they have shifted away from whole cell vaccine to acellular vaccine because it is very, very difficult for us to convince the mother when the child develops that incessant cry, seizures, fever, even though they are all treatable one, it is very, very difficult to convince. So majority of private practitioners have shifted to acellular pertussis vaccine at the cost. Okay, you need to pay more. It is 10 times more compared to a whole cell pertussis vaccine. But absolutely it is feverless. We didn't find any seizures, we didn't find any pain. But is it possible to spend that much of amount in government for all those people who are coming there? Not possible. Again, you need to take risk-benefit ratio. In Chengalpattu Medical College, after coming here, in the past 4 months, I had seen 2 cases of pertussis-induced encephalopathy, pertussis-induced unresponsiveness in 2 kids. But there are thousands of kids had received that pertussis vaccine. So what do I mean? Whenever there is an affordability, go for acellular pertussis because it is going to avoid so much of answers that you need to describe to the mother. Pentavalent whole cell pertussis vaccine is prone to produce high-grade fever, persistent cry, inconsolable cry, severe pain at the injection site, as well as fever-induced seizure. Yet they are all treatable. How much you can convince that the ball is in the court? If the child is poor, if you are able to convince the mother, go for whole cell vaccine, but beware of treatable side effects. Okay? Right. So paracetamol and reassurance is more than enough. Case 3. Remember, my dear friends, after giving any vaccine, the child can develop fever. The fever in turn can produce seizures. These are all called febrile seizures. It doesn't mean that the MMR vaccine is directly producing the seizures. The MMR vaccine would have produced fever. That fever in turn produces seizure in a child with a high risk factor like family history of seizures or family history of febrile seizures in a predisposed individual with a high risk factor. Again, after giving vaccine, if the child develops fever along with seizure, remember it is going to settle within a day or 2. Just inform the mother, don't worry, I will take care. Next, injection abscess clusters. Remember, my dear friends, each and every vaccine when given without any sterilization of the injection site area is prone to produce abscess. Okay. So when in a particular setup, if more than 2 or more people develop the same symptom, same abscess, It is due to the lack of sterilization at the site of injection, and it is not produced by the vaccine per se. Personally, I have been seeing many cases of large indurated subcutaneous tissue in children receiving 6 weeks, 10 weeks, 14 weeks, and 1.5 years vaccine. Why? See, DPT vaccine, you need to give deep intramuscular vaccinity. You need to give in the anterolateral thigh, 1 inch, 2.5 centimeter deep into the thigh. But majority of your VHN, ANM used to give in the subcutaneous site. That itself produces an induration, an abscess-like thing. So when you are in your OP, particularly when you are posted in vaccination OP, you please teach your VHN or ANM when you are working in a PHC. You teach your staff nurse when you are working in a medical college or in your district hospital posting that your DPT vaccine should be given 1 inch deep intramuscular in the anterolateral thigh. Do not pinch and give. When you pinch and give, pinch the skin fold and you give the vaccine, it becomes subcutaneous. More often, they are all painless. They are all sterile abscess. They don't need any treatment except a very rarely an incision and drainage. Majority of injection site abscess, sterile or infection. Sterile abscess, just drain. It will not be painful, just observe. Painful abscess more often due to the contamination while giving vaccination in that site. Sterile abscess, don't worry. Painful abscess, INT, it's your fault. Sterile abscess, it is the poor not giving IM, instead you are giving subcutaneous, whereas painful vaccine is not cleaning that area properly. Right? Remember, live vaccines like MMR, varicella, PCG will be available in a separate bottle. That vaccine powder will be available in a separate bottle. Another diluent they will give. What we do usually, we used to mix that diluent with the vaccination and we used to give that constituted vaccine to the patient. Remember, my dear friends, these reconstituted vaccine should be used within 4 hours of reconstitution. If that reconstitution vaccine crosses more than 4 hours after reconstitution, there are very high chances for Staphylococcus aureus contamination. And after giving that vaccine, so by about 6 o'clock, you mix that vaccine, you forgot it, that patient is not coming, and you keep that vaccine in the fridge. After 4 hours, the patient is coming, you are giving, there are chances for the patient to eat. I am not saying they will develop, they may develop. So do not give reconstituted vaccine for more than 4 hours. Once you reconstitute the vaccine along with the diluent, please give the vaccine as early as possible. Do not wait for more than 4 hours. High chances for Staph aureus, high chances for contamination leading to toxic shock syndrome. Pneumonia after vaccine. Remember, whenever majority of the times our staff nurse, VHN, ANM used to send the case when they develop cough, cold and coryza. I repeat, a simple cough, simple cold, simple coryza is not a contraindication even for live vaccine. But what happens? The child may develop initially when the child will have upper respiratory tract infection in the form of URI. And the child comes to you, you give vaccine. That URI flu itself would have produced LRA, that is pneumonia. But people will definitely attribute that the pneumonia is due to this vaccine. Sir, I came on Wednesday, my child was having cough and cold. You told that after giving influenza vaccine, nothing will happen. But 2 days later, my child developed severe chest drawing, retraction, hypoxia, admitted. I would like to know whether that vaccine has produced pneumonia. This is how the patient was asked. So that's how majority of doctors avoid giving when the child is having fever, when the child is having cough, when the child is having coryza, when the child is having diarrhea. But by and large, minor illness is not a contraindication for vaccine. Remember, my dear friends, as far as the world is concerned, more and more influencers are there. More and more misconceptions are there. At times, our allopathy can also lead to some miscommunications. Last year, they will tell you that this study is good. But now they will tell you, no, that study is bad, you give this medicine. This is how it runs. So how can you protect yourself from the parents? The answer is one. You need to be a friend to each and every patient that you see. When you don't develop this attitude of being friendly with your patients, definitely you will land up in trouble. Who can assure that your vaccine or paracetamol will not produce any side effect? Anaphylaxis can happen even after paracetamol. Okay, so who will protect you? If you think that you have documented everything properly and you have you have got the consent and you have got so many gundas in and around you to protect you, no, it can't happen each and every time. Even after completing your DM or MCH, you will tend to do mistakes. So what thing will protect you? Proper communication, a good, friendly, cordial relationship with the parents, with the patients is the one that is going to save you in future. Not your loss, not your money, not your power, not your concern, not your ethics. Be friendly with your patients. If you say something, your patient should say, he is my doctor, I will obey him. That is not in that is not in his hand, that is in your hand. Take control of your patients. How can you take control of your patients? By having a proper friendly relationship without hurting their sentiments in the form of using some facts. Okay, because so many times these young minds, when I say, Emma, go and get consent for endoscopy or bronchoscopy, now they will say, sir, I told them we will put one tube inside the nose, it can produce bleeding, it can produce pneumothorax. Now, if you explain in this way, who will go for that? Instead, what you can say, Amma, while the child is trying to learn the bicycle, the child used to fall, the child used to get some hurt, some wounds. Don't you continue giving training with bicycle or scooter or car? You do. In the same way, kuti chota things will happen during each and every procedure. It should not be a major thing that should happen. So please develop proper communication skills. Okay, next. Meningitis post-vaccine. You could have given vaccine. The day up to the child develop fever, the fever in turn will produce febrile seizure. Or else in a child who is in the incubatory period, you would have given vaccine. The mother will blame you that your vaccine has produced meningitis again and again. You need to say, you need to explain in a polite way that it is not coincidence, it is merely a coincidental one and it is not due to vaccine induced meningitis. And you all know, even 14 years, 15 years, 20-year-old girl, MBBS girl who came to my clinic last month for hepatitis B vaccine. Okay, while giving vaccine, because of the pain she develops in cold, it doesn't mean that she developed anaphylaxis. Pain shop can produce syncope. Is it a contraindication to vaccine? No, my dear boys and girls. It is a simple vasovagal attack in which you need to make the patient to lie down. That's all. Again, fear of giving vaccination. Many people used to hyperventilate. Is it a contraindication for vaccination? No, it is not. Okay, but some vaccines like rabies vaccine, flu vaccine tend to produce acute disseminated encephalomyelitis. There are some reports, even in my clinic, one child developed acute disseminated encephalomyelitis, a demyelinating syndrome, after getting influenza vaccination. But this is usually a causal relationship. It is very, very difficult to prove that that Adam was due to flu vaccine or rabies vaccine. But again, if the mother says something, if the child really needs that vaccine or booster, you give. Otherwise, if the mother is little bit hesitant, and if you think that vaccine is that much important in their day-to-day practice, better not to compel them. What we call it as நேர் விருப்பம். மோடுகிறா போட்டுகிறியாமா போட்டுகோ, புடிகலையா விட்டுரு. Okay, well and good. But ஆனா ஹிப் வேக்சின் என்னால அப்படி சொல்ல முடியுமா? You need to go for it. Okay, right. As I told you already in my second slide, remember, my dear friends, before giving BCG vaccination at birth, kindly ask, is there any child developed pneumonia, died of pneumonia in the past 1 year in your family? Is there any history of elder siblings suffered because of pneumonia and death? That could be a red flag, because it usually manifests as persistent pneumonia in children between 2 to 6 months. That pneumonia usually would have produced by this BCG vaccination. So while giving live vaccine, kindly ask, is there any family history of vaccine-related events, right? So what is adverse events following immunization? Immunization is mandatory. By and large, we protect so many people. So many people we are protecting. The answer is yes. The risk-benefit ratio, yes, the benefits are huge, but not at the cost of absence of side effects. There are some side effects. So any untoward medical occurrence following immunization should be reported as adverse events following immunization, even whether it is mild, moderate, or severe. It doesn't mean that, as I told you already, when you give pertussis vaccine, there are very high chances for you to get fever, incessant cry. But there are reported, well-proven side effects for each and every vaccine. When you have some side effect which is not reported elsewhere, you need to worry that this vaccine would have not produced that particular side effects. Majority of them vaccine in adverse events following immunization are mere coincident. Okay, what are all the types of adverse events following vaccination? One is vaccine reaction. As I told you, DPT will produce fever, febrile seizures, encephalopathy. BCG may produce BCGiosis in children with immunodeficiency. They are either vaccine inducing or vaccine producing side effects. They are established side effects. But majority of them, cluster of people developing abscess, cluster of people developing toxic shock syndrome, are merely due to program error. The syncope, hyperventilation are due to manifestations of behavioral issues to the vaccine, to the injection, and not to the vaccine. As I told you already, the child would have been in the face of viral coryza and you give vaccination, the next day the child will develop pneumonia. It is mere coincidental and it is not related to virus infection. A study has been conducted, okay, in 2024. It is published in 2026. Okay, Majority of the side effects are studied in children less than 5 years. So what is the end of the study? The study objective was to find out any adverse events in children receiving immunization under 5 years. So this study was conducted in Victoria Hospital, Bangalore. Okay, 30 adverse events following immunization: vaccine induced, vaccine potentiating, coincidental, program errors, all are included. But despite the huge number of people who receive vaccination, only 30 cases has been reported. And majority of those events occur in the first 6 weeks, 10 weeks, 14 weeks, and majority of male children is getting affected. But I don't think there is a link with respect to adverse events. And as I have been telling you repeatedly, pentavalent vaccine whole cell pertussis is prone to produce high-grade fever, seizure, intractable cry, inconsolable cry, sometimes can lead to encephalopathy also. The most common side effect is following pentavalent vaccine. So what are all the vaccines that are associated with this adverse events? Most common is pentavalent vaccine, that whole cell pertussis. If you remove that whole cell pertussis and replaced by acellular, almost that 40 will become 4 or 0.4. BCG related, as a pulmonologist, as a person who was running a primary immunodeficiency clinic, basically I'm a little bit afraid of this BCG live vaccine. The answer is simple. Before giving BCG live vaccine at birth, kindly ask, is there any history of infant death in that family due to pneumonia? If it is, please do not or postpone the vaccination unless you get a proper opinion or diagnosis regarding the first child death. Measles, rubella vaccines are prone to produce thrombocytopenias. Yes, some encephalopathy. But in my practice, I have not seen any side effects with respect to MR. Again, pentavalent and DPT, the P aspect of DPT or P aspect of pentavalent is responsible for all those systemic side effects or local side effects. IPV, injectable polio vaccine, in this study, 3%, literally I had not seen. Systemic side effects. What do you mean by systemic side effects? As I told you, fever, encephalopathy, seizures, intractable cry, particularly with respect to 6, 10, 14 vaccines. But local reaction, again, erythema, induration, are again program errors rather than vaccine per se. They are giving subcutaneous rather than intramuscular. That pentavalent or trivalent vaccine at 1.5 years. Fever. So what are all the other things? As I told you, convulsions can come following DPT vaccination. Injection site aspects, yes, adenopathy. Remember, left axillary adenopathy, unless otherwise proved, any persistent lymphadenopathy in your left axilla lasting for more than 4 weeks must be considered as BCG-induced adenopathy unless otherwise proved. Book says it is normal. But by and large, I will not believe. Big book says instead of intradermal, people are giving subcutaneous. That's why you are giving left axillary. It is not so. The most difficult vaccine that you and me can give is intradermal vaccine. Majority of them will inadvertently give subcutaneous only. But most of them are not developing left axillary adenopathy. Only few. If your vaccine crosses that particular site of infection, particularly BCG, think about an underlying immunodeficiency. And I'm not threatening you. Almost 95% of vaccines are safe. That 4% side effects are produced by whole cell pertussis. Serious events in a country like India, where we have 160 crore population, you need to vaccinate them. Safety profile when compared to population is highly good. But remember, any child who develops some serious issues after vaccination, if there is such history, kindly avoid or kindly postpone or admit the child and give vaccination. Sterilize that area properly. An intramuscular vaccine should be given intramuscular or not subcutaneous. Reconstituted vaccine should be used within 4 hours after reconstitution. Live vaccine, while giving, rule out the child is on any immunosuppressive drugs or immunosuppressive history. Okay. Always have adrenaline preloaded in your clinic or hospital at the time of vaccination. Anaphylaxis do occur very rare. If it occurs, the drug of choice is IMA-MSN. That is the cheapest drug you have, the wonderful drug you have. You need to have a resuscitation kit, an ambu bag, a laryngoscope, and adrenaline, everything. But remember, it won't occur. Anaphylaxis, I have not personally seen. But that local side effects, systemic side effects of pertussis, BCG-induced local and systemic side effects, I have seen quite a, not uncommon, but I have seen a few. Okay, right? And remember, after vaccination, make them to sit for about 15 to 30 minutes and then they let them go home. Okay, so predictable reaction you explain. Predictable reaction, local pain, systemic side effects with the DPT. Mild thrombocytopenia with MMR. These are all predictable. No need to worry. Okay. As I told you, prepare for emergencies. It won't occur. If it occurs, have adrenaline, have emergency kit. Okay. So then, yes, some live vaccines do have, but majority of side effects are mainly due to program errors. But beware of live vaccines too. Always think about benefit risk ratio. Always have adrenaline. Always sterilize the area. Always vaccinate within 4 hours of reconstitution. Let's build a healthy environment, healthy future, healthy nationals. I hope my children who are listening to this topic will benefit and they will do a rational practice. Thanks a lot for the opportunity given. With this, I am completing my topic. Yes.
Thank you so much, sir.
Okay.
Thank you so much, sir.
Thank you.
It was a thought-provoking session. Sir's clinical approach, along with your wise words of wisdom, made us completely absorbed throughout the session, sir. Thank you so much. I call upon Grace Angel to deliver the vote of thanks.
Good evening, everyone. I'm Grace Angel, a final year MBBS student of Mada Medical College and a member of the Mental Health Subcommittee, IMA-MSN TNSP. It is an honor to propose the vote of thanks for today's session. Today's session on vaccine hesitancy in the modern era was not only timely, but also highly thought-provoking. In an era where misinformation spreads rapidly, discussions like these are essential in shaping us into responsible and informed future doctors. I would like to begin by expressing a heartfelt gratitude to esteemed speaker, Dr. B. Sarath Balaji Sir, Associate Professor, Department of Pediatrics, Government Chengalpattu Medical College. Sir, thank you for an exceptionally engaging and insightful session. Your ability to present a sensitive and complex issue like vaccine hesitancy with such clarity, backed by scientific evidence and clinical relevance, has surely enriched our understanding. Your emphasis on communication, trust building, and ethical responsibility in medical practice is something that will stay with all of us. I extend my sincere thanks to the patrons of IMA-TNSP, our state leaders, and the entire state team of IMA-MSN and JDN Tamil Nadu for their constant encouragement and support. Your leadership continues to provide us with platforms to learn, grow, and contribute meaningfully. A special word of appreciation goes to the organizing team, especially Avinash R., Shruti Shivakumar, Partha Sarathi S., Raihana Tasneer, and all the members of the academic, technical, and mental health committees for the dedicated efforts behind the scenes in ensuring the smooth execution of the session. Lastly, I extend my sincere thanks to all the participants. Your active involvement and keen interest are what makes these sessions like these truly meaningful and successful. We truly hope that today's discussion inspires us to approach vaccination not just as a clinical responsibility, but as a commitment to public health advocacy and patient trust. With this, I extend my gratitude to each and every one of you and formally conclude today's session. Thank you all and have a great evening.
Thank you. Thank you. Thank you.
Thank you, sir.
Thank you, sir. Can I stop the live? Yes,
Yeah.
bro.